So this is Dr. Garth Small. He's the hero who's been looking after our beautiful special boy.
Yeah.
Thank you so much for your care. What I loved about the actual cesarean procedure was that you were there, you were ready to receive him, and you've been looking after him ever since. So it's now day 3. So Spencer is 3 days old. And we've been discussing this morning Spencer's weight loss because obviously it is normal for babies to lose a little bit of weight, isn't it?
Yeah, so within 10%
Okay.
is considered normal for a
Okay.
term baby, and that's that fluid loss. So they've come from in the amniotic fluid, they've got a lot of extra fluid, and when they come out, they wee that out, they breathe it out, and we expect anywhere between a full 10% essentially is considered normal. So you've had a couple 100 grams, which is well under 10%. So
Oh,
there's no
that's-
concern from that perspective.
That's great because we have been a little bit worried about his feeding. Like he seems to be a bit of a he'll suckle at the beginning to get rid of those hunger pangs, I think. And then we have been a bit concerned because then he seems very happy to drop off to sleep. And it's hard basically feeding a newborn because you're not quite sure how much they should be getting. And
Yeah, and that's you become the expert in that, to be honest. So
Okay.
you'll start to understand Spencer and understand when he's full. You start to read his cues a little bit better. You also can feel the letdown from your milk supply. So in the early stages, it's difficult, but it definitely becomes easier.
yeah, it can be a bit anxiety inducing, though, can't it? Yeah.
And we always watch the weight as well. So we watch for growth, and if we know we're growing normally, we're obviously getting enough in.
Oh.
So weight's good now. So we've been getting enough in up to this point in time. So happy with that.
That is very reassuring for us. Like that is extremely reassuring. And we did have some bruising on his shoulder, didn't we, after the extraction?
Yeah,
So
so it was a little bit of a difficult extraction, but
we had an X-ray yesterday.
X-ray was all normal.
That is a big relief.
How do we get this? Oh, have you got
Yeah, a bit tricky.
good fingernails here? Oh, look at this. Oh, he's taking his tongue out.
Oh, he's got the best expressions. It's so funny. We sometimes get the vibe that we're gently not telling him off, but like the other day I said, "Oh, now you're just sleeping on the nipple," and he seemed to go, like.
That's a comfort spot.
Yeah, exactly. Oh, we're checking his heart rate now. Aren't we?
That's okay.
Yeah, it's good to get a doctor check. Yeah, do you like his socks? They're way too big.
They are very big. It's going to take a while before he goes into those.
I know, I think they're the smallest ones we could find at the time. I've got some more express breast milk in a bottle waiting for him, so after this I'll definitely give him some more, couldn't I? I'll try.
Yeah.
Because that's a bit of a comfort for them, isn't it?
Yeah. You always want to be trying on the breast first, though.
Oh, sure,
Because
okay, yeah.
we want to get him independent off the bottle.
Off the bottle, yeah, absolutely. Yeah, no, that is very true.
Is there a little clip up here? No? Okay. Is there no clips? Tight one, hey? Tight over there. There you go. Feels a bit tight, this. There's no clips on the back?
Don't remember which one.
Okay, there we go.
Oh.
There we go. Oh, no, buddy.
Yeah, he's not a fan of being breast. I don't think any baby is.
That's better. You've got a good suck there.
Yeah, he's been doing quite a bit of meconium. Every time we change his nappy, there's more.
What colour's the poo now?
It was still black this morning.
Yeah.
Is there more meconium there?
No, nothing in there.
Okay, yeah, we just had a change and a feed. Maybe half an hour ago. Oh, you're having a look at his hips now.
Yeah, so his hips are nicely stable. So with being in the breech position, he's an increased risk of hip dysplasia, but they feel good. So we'll just get a hip ultrasound at 5 weeks.
Yeah. Yeah, I did read that when he was breech. I was reading about breech babies, and when I saw that, I thought, Oh. Because I was thinking he was looking skinny today.
Oh no, he's a good size.
Oh, really? You're happy? Yeah. Oh, that's,
Yes, you are. Hey?
oh, that's
Hello.
good.
Hey?
Oh.
Seeing what he's doing with that arm. He's been moving the arm around much.
Yeah, it doesn't seem as sore like he does.
Hey?
Or it's still not as much movement as you'd like, or?
Yeah, just seeing what he does there.
Okay.
He's not quite moving as much as he is on the other side there, but he's
Right, yeah.
normal resting position. There we go. Right.
I can't tell you how much I'm so touched and moved to see someone caring for our baby like this. Like it.
Really well. Hey, buddy. Hey. Now I'm just going to do the startle reflex, so I'll lower him down quickly, but I won't drop him, okay?
Oh, sure, yep, okay.
Alright, ready? Ready, up. And hand down. Oh, very good. One more. There we go. Okay.
Was that good? Like,
Yeah, so he's still got that little bit decreased on that side there. So there
Okay.
might be a bit of swelling
Okay, sure.
around that
yep.
area, which is affecting and causing him to limit the movement of that right shoulder.
So he might experience a little bit of pain if he moves it,
Yeah.
do you think? Yeah.
But he's doing okay there. Hold on, buddy.
Oh, is that checking his eyes?
Yeah, I'll get him wrapped up so he's a bit
Oh, thank you.
so I can check his eyes properly.
Just thank you from the bottom of my heart for the care, because
He's doing good.
he means the world to us. Him and his sister. You should have seen his sister interacting with him yesterday. She adores him.
Hello. There you go. Look, eyes nice and awake there. Hello. How you doing? How you doing? Hello. Oh, you're looking about everywhere. Yes, you are. You're really cute. Hey? Very good.
Look, this is probably a no-brainer, but you must really like kids.
Oh yeah, I love them. Babies are the best. Yeah. They're good. Looks good. Looking good.
Oh, that's so fantastic. I can't tell you how grateful we are for this. Like, just keeping him safe, honestly. And they're so vulnerable at this age. Like, yeah. So you specialise obviously in what are they neonate or what's that?
Well, we cover both neonates and up to essentially from the the time they're born up to 18 years of age. So
Oh, right.
specialise in paediatrics.
Okay, yep. And what do you love most about working with the babies?
Oh, they're cute. They're fun. You know, everyone's happy.
Yeah.
They get better quicker. Yeah, they
What are
generally
the-
respond pretty well.
Yeah.
Like we came out, we're in an unwell state, but look how great we're doing well.
He's and look, it's your care too. We're so grateful you've given us the best advice, and I would do anything you say, obviously, and we
Yeah,
have,
he's doing
and
well.
yeah, and what are the challenges though about working? Because it must be really hard when babies are really ill. I mean,
Yeah, I mean, it is very hard when you do get the sick child, but that's
yeah,
less frequent than you'd expect. So you don't get too many of them. Okay, most kids respond quite well and
okay,
with appropriate therapy, and we don't get that many that are really sick. They do come every now and then,
Yeah.
in which case it's quite hard at those times, very challenging. But most of the time we get babies that respond well to the treatments that are available.
So what's our plan forward for now then?
So continuing feeding as you are, so doing really well.
Okay,
We
yeah.
just got to monitor growth,
Yep.
and then we've got to get the hip ultrasound at 5 weeks of age to recheck those hips.
Okay.
So all the hormones are out of the system, but they're examining completely normal today.
Okay, and do we then come back here to see you? Or
Yeah,
do
so I'll
get the
see you at
report?
6 weeks to touch
Okay.
base, and we'll check growth and development. Any concerns from now to then, the midwives will contact me because you'll be seeing them every week.
Okay, sure.
Any
Yeah.
concerns before then, you contact my rooms.
Thank you so very much.
No
We're
problem.
very grateful.